So, are nursing instructors gatekeeping information? So, today I want to tell you three things that your nursing instructor won't tell you. So, hi, I'm Deb the nurse, and I help overwhelmed nursing students save time studying by giving them tools and showing them what to focus on so they can pass nursing school and ace the boards. So, let's get started. The first thing that nursing instructors aren't going to tell you is that lectures are not going to get you through the NCLEX. They're not designed to get you through the NCLEX. So we know that it takes 5 to 7 times with experiencing or reading or hearing information in order for us to actually learn it. And so, in order to facilitate that, we need to use tools and processes so that when we get the information, we can absorb it and organize it into a usable form. So, we'll talk about some tools a little later. All right. So, the second thing that nursing instructors are not going to tell you is that smart students question everything. So I didn't say that they question the instructor, they actually question themselves. So they're like, self, what does this mean in my own words? They're not rereading the same thing over and over and over again. That's called memorization. And if you didn't know, memorization does not work for the nursing process. Therefore, it's definitely not going to work for the NCLEX. Girl, your memory will fail you. You're really, you're going to get an F. All right. So now the third thing that nursing instructors are not going to tell you, never, ever are they going to tell you this, that you study too much. So, how about this? You go to your nursing instructor and you're like, oh, do you have a study guide for the upcoming test? And what does she say? Everything's in the book. Or she says, the dreaded, you just need to study more. And what are you, if you're like most people, you're thinking, oh, I don't have time to study all this. It's too much information. I don't even know what to focus on. So, girl, listen, you got 25 NCLEX review books, you got 10,000 Quizlets, and you probably have 200 test bank memberships. So your brain has nowhere left to store anything. No wonder you don't have time to study all this. So I'm going to give you some tips on how you can change the way you study starting today and start to improve your test scores and start to develop that critical thinking that we needed. You're going to hear that critical thinking over and over and over again in nursing school because that is what's going to make you and break you on the NCLEX. Not that memorization. You got to take that knowledge that you read about in the book, and then you've got to be able to think about it in a different way and apply it to different scenarios that they're going to give you. And with NCLEX, the key is safety. So they want to make sure that you can apply this information in a safe way. All right. So what are our tips? All right. So I like to do things easier, not necessarily harder. I don't want to take longer to do it. So I believe in using tools over time. So we're going to use some tools here. And for these tools, all you're going to need are three things, and they're nothing that you have to buy. So the three things are going to be your syllabus, your slides, and your planner. Your planner can be, it could be a book planner, or it can be your phone or your Google Calendar, just somewhere where you can keep track of all the things that you need to be getting done. All right. So we're going to start with the planner and the syllabus. So you're going to take those two things. Hopefully, your instructor sent that to you, hopefully ahead of time, so that you can have time to get your system in place. But you're going to take that syllabus and your planner, and you're going to write down. This is an area where a lot of students just really breeze past the syllabus. The syllabus is it's your GPS for your class. It tells you everything you need to know, when the assignments are, how much you need to score on the exams to pass. It tells you everything. So you really need to stay on top of those syllabi. So when you get your syllabus and your planner, you're going to now transfer everything over into your planner. When is the test? When are the assignments? What week or day are we covering certain specific topics? We want all of that transferred in there, because every day when you go to look at your planner, it's going to be giving your brain a little hint about what's coming up for that day. And it kind of prepares our brain to be ready to absorb that information. So now you've got your stuff over in your planner. So now what you're going to do is you're going to get your slides, and you're going to take the slides. I prefer to print them out. You can write if you prefer, but I prefer to print them out and then write next to the slide, so that when I'm in class and the instructor is got her slides up, I can follow along on my paper and I can write my notes. So again, this is before the class. We're not waiting until the day of the class to start doing this, because as I said, we need this information 5 to 7 times. So you're not going to be able to absorb it sitting in a 1 to 2 hour lecture. You need to do some prep work. So you've got your slides out, and you're going to just read through the slides, and anything that doesn't make sense, you're just going to put a little question mark there. You're not going to you don't have to try to look it up or do anything else. It's just preparing your brain for this information. All right. So now, after you've done that, you're done. Should take you 10, 15 minutes. Very quick. The next day, or you're going to continue reviewing, just reading over these slides. Hopefully every day you should be doing this until class start. If you get your syllabus a week ahead, then you can do this for a week. Every day, 10 minutes, not long. And then you will be ready when you go to class. So think about it. If it takes 5 to 7 times and you've read over this material for a week, that's 7 times. So your brain is primed and ready for whatever this instructor is going to say. So now you go to class and the instructor starts talking. Anything that you had a question mark by, your brain is going to be primed and ready it's waiting. Your subconscious is waiting to hear this material because it knows that you had a question. So this is an effect that we call the incubation effect. And what this is it's probably happened to you where you were trying to figure something out, or work out some kind of problem or something, and you got frustrated and you just said, forget it. And you went to bed, or you went and did something else. And then the next time you thought about it, or when you woke up, boom, there it was, the answer. So this is what our brain does. It continues to work on things even when we've gone on and we're doing something else, or we're sleeping. So we are going to use this in nursing school to help us absorb this material in an easier way. So now you're listening in class, you've got your little question mark, so you're going to know right away what you had questions about, and you'll start to see that as the instructor's talking, some of those question marks are going to be answered. It's going to make sense. As she's saying it, you're going to understand it. So now you finish that class. In the evening when you go home, you're going to just 10 minutes, 20 minutes top, you're going to read over that information just to refresh. Every day you should be rereading that information, and You can, it's really good if you can change like the format of it. So maybe you can make yourself some fill in the blank. So you can take your own notes, not photo. Listen, a lot of students want to take their phone and take a picture of what the instructor has written on the board. You need to experience the material, work with the material in different ways. We learn in a lot of different ways. We need to see it, we can touch, we can hear. The more ways that we allow our brain to work with this material, the more it's going to stick. So I recommend writing stuff down. So now you are going to you're at home and you're studying this every day, so just try different ways of writing it. Like you could, like I said, fill in the blanks, make up questions just based on what you've written. You can make your own quizlets. um, you can, if it's, say it's something with the cardiac system, if you like to draw, you can draw the heart, or whatever, but as long as you are interacting with this material, it's really going to make it stick for you. Okay, so that is what you're going to do every day, and you will start to see that your grades are going up, and you will start to see that you have that deeper level of understanding. And once you have, you're not just memorizing and trying to spit back out facts, just memorize facts. You're going to be able to answer the questions when they ask you, what would you do because of this, whatever your intervention might be. So these are the things. I hope that this is helpful to someone. I thank you for listening. And I if you're feeling overwhelmed, and you want to get serious about passing your NCLEX, then I can help you. I can give you some tools that's going to help you pass your nursing school exams and your NCLEX. Listen, if you wanna stick to the easy way and keep doing your 10,000 Quizlets, then, you know, okay. But if you are an action taker and you are ready to stop making excuses, ditch those excuses, you can click the link down in the description and set yourself up for a coaching call. So thank you for listening.